Okay. Dr. Davidhizar, let's talk about something which I think every person I know, including me, has at one point or another experienced and kind of said that, gee, this is not good. And that is being fatigued, exhausted, tired, not being up to par of what, based on age and based on what we should do. And, I'm a relatively energetic guy, but the truth of the matter is, I would like to have more sometimes, and every so often I'm not quite as energetic as I should be, and it's bothersome. It brings all kinds of weird thoughts in it, such as, is it over? Am I done? Did I just, cross the peak? What's going on? Anyway, what can this bring about? What can one do, without pumping itself with coffee all day long and with Twinkies?
Yeah, well, a lot of people have issues with energy. There, of course, can be a lot of medical reasons to have trouble with this. There's all these advertisements on TV now about having low testosterone, and that's a factor for some people. Thyroid problems can be a problem. If you're diabetic and you have high blood sugars, that makes you exhausted as well. If you have poor circulation, there'll be problems. So when people come into my office and they're complaining about fatigue, there's a battery of tests we run originally just to make sure there's nothing, medically organ-wise that's causing the problem. Frequently what the problem is depression is the number one cause of tiredness and fatigue. So we always ask those questions. And if all that checks out to be normal and there's no issue there, then what I try to get people to do is most of the time they're not getting enough exercise. There have been tests done that show that people that are hospitalized where they stay in bed for a long period of time, they lose muscle mass and, of course, bone mass as well, but they have very little energy. So when they get up and try to go back to their normal activity, they're exhausted all the time because they've let their body sort of atrophy while they were laying in bed. So the key is to be active all the time and do exercises, keep going, keep your circulation good, and those sorts of things. That usually helps tremendously for people who have no underlying cause for their fatigue. And eating a good diet, getting your weight down, all those things help. But lots of times there is some medical reason that's causing the problem, especially if they're young, healthy people. But like I said, the most common cause actually is depression. And so if we treat that usually causes the fatigue to resolve as well.
Now, I've heard you mention depression, and a little bit before you mentioned the thyroids and stuff. So I've heard that, if your thyroids start working slow, then you do get tired and exhausted, and you get the feeling of depression also. Number one, is there some truth to it? And number two, in this case, to some people, is there an easy way to get the thyroids going, or get the testosterone up again or something, or is that all very difficult?
No, once you get the blood test and we find out that's what the problem is, we put people in thyroid medicine or we give them injections of testosterone to get it back up to normal. And then usually their tiredness goes away.
And that's something...
Usually if there's a metabolic reason for it, some system of your body that's causing it, it's usually fairly easy to fix.
And is it able to be fixed, for the normal person who doesn't exactly have the money of a Tom Cruise or something like that? Because there's data out there that, all these hormones and blah, blah, and all those type of things, they're super expensive. Is that true, or can actually us living beings afford it too?
Actually it's pretty affordable in most cases. Now, some of the hormone tests are a little more expensive, but, if you have insurance or even have a reasonable income, usually they're not out of reach by a normal person. And the other good thing is the treatment for it usually is pretty cheap. Thyroid medicine's been around a long time, so it's pretty inexpensive. The testosterone, unfortunately, is a shot only. That's when we can retake it to make it effective. Actually, there's some patches and things they're doing now, dermal, that actually work pretty good too. But most people are still taking injections, and that's not all that expensive. And you can get a shot once a month, and it's a long-acting shot, so you don't have to have that many shots. So I think it's within the grasp of everybody to be treated if that's their underlying problems.
So, and energy comes back.
Yes.
Okay. And of course, you did mention again, like you mentioned so often already, that a lack of exercise, it's almost like when you exercise, it looks like the way it is that the body generates certain type of, life forms and whatever it may be, which then makes everything working, because you mentioned it this time also, your diet. Of course, whenever we're tired and exhausted, the last thing we want to do is do exercise. And so basically more has to be done in order to generate energy. Is that what you're saying?
Yes.
Okay. All right.
And it's hard if you haven't exercised. And I always tell my patients, just do it for 5 minutes. You get them just do it for 5 minutes. They'll frequently go a lot longer than 5 minutes, of course, and that's the goal. And eventually they'll be able to go a lot longer than 5 minutes. Mm-hmm. So you just got to get started.
Mm-hmm. Okay. And what do you do to make them compliant? You have a camera in their house or something, and call them up when they don't do it or something like that? Well, how do you do that?
No, you can usually tell if they're doing it or not by how they're doing. But it is hard, but especially if they're busy and they're got a lot of things to do, it's hard to work that into some people's schedule, but it's an important part of your life. If you're going to be healthy and enjoy life, you've got to do some of these things for yourself. So we try and point out the pluses, and once you get started, it's been shown that if you exercise for 90 days, you pretty much get addicted, and you feel so good doing it, you don't want to stop. So, but getting to the 90 days is the hard part for most people. That's a long time when you're forcing yourself to do something that you don't really want to do. But hopefully before the 90 days, some people will start doing better with that. But at least by 90 days, most people are doing great and don't want to quit.
Well, because, having no energy and being tired and exhausted, personally, I think I look at, as I said, it sometimes happens to me, but on an average, I'm pretty up, and I look at lots of people, and it looks to me they're getting up tired and exhausted, and life is difficult. I remember my wife some 2 or 3 years ago when we met, and when we, were driving in the car or maybe sitting at the kitchen table, and I wasn't talking because I'm usually just yap, and so is she. And so she thought I was upset with her. Till she finally, slowly, over a year time or so, figured out that, no, I'm not upset. I'm just tired. So, if a person can feel that, think you're upset, and because you're there, you're driving and you're not saying anything because you're tired. Imagine how dull life must be in terms of imagination, in terms of, business ideas, solving problems, and we all have plenty of them, if we're not feeling, doing something because we're exhausted. Because when the body's exhausted, with no doubt the mind gets exhausted. At least that's my feeling, So I think it's a really good thing. You see lots of people having a lower level of energy and they don't even know it anymore because it's normal for them.
Yeah, that happens to some people. The other thing we didn't mention is sleep apnea. That's a huge problem if you have sleep apnea with being tired. I have quite a few patients that have that, and once we get them treated, they were like a new person again. They couldn't believe that they could feel that good.
That's because on sleep apnea, what happens is you wake up several times throughout the night and you don't even notice it, but you do, and you get no oxygen during the time when you stop breathing, right?
And you never, plus you never get really good REM sleep because you never get into this deep sleep. So that's where you get most of your rest and recovery time is in REM sleep. Mm-hmm. I've got several patients that they were stopping breathing like 70 times an hour. So
70 times an hour?
Yep.
Holy cow.
So those people they couldn't stay awake hardly. Every time they sat down, they'd fall asleep. And it was kind of a joke at the family that, don't talk to Dad, he'll be asleep right away.
In fact, it's interesting that you mentioned that because I knew a dentist who told me that years and years ago he was constantly exhausted, constantly tired, slept 9 to 10 hours, 8 to 10 hours anyway, a very respectable amount of number, but yet basically woke up tired, and then he got himself one of those sleep appliances, and I don't know how often he woke up, but anyway, he did one of those sleeping desks, whatever you call it, and that's a decade or more ago, and he's full of energetic. In fact, he told me that he also lost weight after that.
Yeah, actually, that happens to a lot of people. They lose weight because now they have more energy. They start doing things, and they lose weight. And of course, people with sleep apnea, a lot of them are overweight to start with. That's part of the issue. But even thin people can have sleep apnea as well. So it's not just that. There's other issues as well. But for a long time, it was sort of thought that it was just overweight people had this trouble, but it's not true at all. Lots of other people have it. But so those overweight people, once they get treated, frequently they will lose weight because they now start doing things.
Right. Well, absolutely incredible, yeah, absolutely incredible. Well, very insightful, Dr. Davidhizar, very insightful. I appreciate it. Thank you very much.
You're welcome.